Hello, I'm Jerelos. Today I'm going to be talking about iron deficiency anemia as well as sickle cell anemia. Starting off, I'll discuss what iron deficiency anemia consists of. With iron deficiency anemia, the hemoglobin levels are low due to the insufficient amount of iron. It is noted that women are more affected with the condition, and pregnant women even more so. Iron deficiency anemia needs to be addressed right away because there's more than likely an underlying issue. In addition to reduced iron levels, there is a reduction in ferritin levels. Iron deficiency anemia can be caused due to the lack of iron in the diet, chronic blood loss, not being able to absorb iron, liver disease, and infections along with cancer. This is cited from the textbook, page 196. Symptoms may include, but are not limited to, cold resistance, fatigue, pallor, irritability, tachycardia, delayed healing, and menstrual irregularities. This is sourced also from page 196 from the textbook. The test that is often used to diagnose iron deficiency anemia is a routine CBC. This will check for the hemoglobin, ferritin levels, and more so help to determine if it is in fact an iron deficiency anemia. Treatment often depends on the cause. Most of the time they'll prescribe iron supplements and advise more iron to be added to the diet. Iron supplements may cause constipation, so a provider may recommend that a patient take probiotics or magnesium in addition to it. Liquid iron stains teeth and dentures, so they will advise drinking it with a straw, sourced from page 196. Iron may also be injected via IV medication. Doctors will monitor iron levels with routine blood tests to see if there is an improvement. If iron deficiency anemia is not caught right away, it can lead to other health issues such as heart issues and heart working overtime to keep up with the rest of the body. The best way to prevent iron deficiency anemia is to consume foods that are high in iron, such as spinach, tofu, chickpeas, meat, and beans. Next is sickle cell anemia. Sickle cell anemia is passed down genetically. Those who are of African and Middle Eastern descent seem to be most affected by the disease. The disease leads to abnormal hemoglobin. It makes HbS hemoglobin and changes the red blood cell shape to a crescent/sickle cell shape, hence the name. Further explanation of HbS is a direct quote from the textbook. One amino acid in the pair of beta globin chains has been changed from the normal glutamic acid to valine. That is sourced from page 200. The red blood cell cycle is significantly reduced. It's about 20 days rather than 120 days. Hemolysis occurs with sickle cell anemia. The RBC levels are very low along with hemoglobin. Obstruction of the blood vessels occurs, which leads to infarctions. Things as simple as a lung infection or dehydration can lead to a hospital visit. Loss of function can occur throughout multiple organ systems. Jaundice, excess rubin, and gallstones may occur, also sourced from page 200. This is why early diagnosis is so important. Other symptoms may include pallor, tachycardia, enlarged spleen, frequent infections, and delayed puberty. To be diagnosed with sickle cell, carriers can get a blood test done for prenatal diagnosis. They check the fetal blood DNA analysis. Treatment includes hydroxyurea, which is not effective for all patients. Things like high levels of exercise and altitude should be avoided. Folic acid may help. Children are recommended to be immunized, especially against things like pneumonia and the flu, since they're more susceptible to the disease due to the weakened immune system. Prophylactic penicillin may be used. Gene therapy is currently being researched. There are things like bone marrow transplants that are being researched and being done, but unfortunately there is a lack of donors within the African American community. Similarities. Both of them affect the hemoglobin levels, and they both affect the shape of the red blood cells. So, for example, in the sickle cell anemia, it has the sickle cell shape, and in iron deficiency anemia, the shape is kind of different. It's kind of a little bit curved and they're smaller. Differences. Iron levels are within normal range for sickle cell anemia. Iron deficiency is not inherited like sickle cell anemia is. In conclusion, there are similarities and differences, as I had just stated. So iron deficiency anemia, we're really dealing with iron. In sickle cell anemia, we're dealing with it being inherited genetically. And to conclude, thank you for tuning into my presentation. Here are my references, and thank you.